Hey guys, so we were looking at this horse here. We kind of know a history on him. We worked on him a little bit. I took some x-rays on his neck and his back last year. He's got some arthritis at the base of his neck and he does have some kissing spine. So we're kind of rechecking that, seeing how we want to address that. At this point, we've just kind of done some supportive stuff, some diet change, vitamin E. He's had some body work, some manual, that sort of stuff done. He also has some arthritis in his knees and a little bit of arthritis in his hocks. So none of it's really terrible, but he's kind of got a few things here and there, so we're going to help him out quite a bit today. We rechecked some radiographs on his knees. That arthritis doesn't seem to have progressed too much over the last year or so, a little bit less than a year. I've got some x-rays from April of last year, so that's nice to have to compare. He is fairly sore when you flex him, but baseline is actually sound on the front end, so that's good. So yeah, we're going to treat him in the knees, take some of that inflammation out of there, help quiet those getting mildly arthritic knees down. We're going to treat his neck. He is starting to get more and more clinical for some caudal cervical dysfunction issues. I'm going to leave his back alone right now, and we're going to treat his hocks as well. So that's kind of the three-pronged approach from him is going to be hocks, neck, and knees. And he should feel great, and we'll get him back into work and get him back into the barrel arena after that. Soft tissue injury over there, so it could be something like the medial collateral ligament. It could be the joint capsule of that middle carpal joint. So when soft tissues get injured, they can mineralize like that and form kind of this, almost bony looking structure there where it was soft tissue, and that's just one of we call it dystrophic mineralizations. It's one of the options that soft tissues can take when they get injured. Could be kind of a weird extracapsular injection with certain injection products too. Sometimes you see mineralization like that around joints. It'll be a weird spot to see that, but certainly things do happen. He does have a little bit of lipping through some of these joints here, especially on the right knee. Some hardening of the front aspect of those bones. So definitely not the happiest carpus in the world, but not terrible. Is the middle carpal joint, one of the joints of the knee. This is the radiocarpal joint, the upper joint in the knee. So you can do it from a standing position too, but it's just so darn easy to do it this way for me. And a little harder for the person holding the leg up.
Yeah.
But easy to me. Because you can palpate that big joint space that opens up like that much when you're flexed in that position. Joint injections on that horse. We're going to put him on a course of Equine, some systemic, so we can help to kind of decrease the frequency of joint injections and get some kind of better maintained controlled joint health as we kind of continue along this horse in his career. Fairly straightforward. We got a handful of spots on him that we know he's got some issues, some arthritis, some inflammation, etc. So helping him out there and just kind of helping him to feel more comfortable, be able to do his job a little bit better. And yeah, at the end of the day, he's going to be feeling great here in a handful of days.